Hello, my name is Rita Amo Igbinama here, and today I'm going to be doing a presentation on cultural competent nursing care, focusing mainly on Jewish clients. Presenting alongside with me are my classmates, Rachel, Quinn, Mona, and Nisha. Our main objective for this presentation is to give an overview on what culture is, the facilitators of cultural competent nursing care, nursing roles, barriers, and some of the cultural conflicts and resolutions. What is culture? Culture refers to the learned values, beliefs, norms, and ways of life that influences an individual's thinking, decisions, and actions in certain ways. Culture is a very important piece in the fabric of every society. It is diverse, dynamic, symbolic, and unique to every ethnicity, gender, and religion. Culture can also be learned, adaptive, and shared. It is therefore imperative that nurses recognize that every client has a culture. Facilitators of cultural competent care. To provide a cultural competent care, a nurse must recognize his or her own culture, have cultural knowledge about their client's culture, know how to integrate and respect the cultural differences in order to provide a holistic and therapeutic client-centered care. Self-reflection, acquiring cultural knowledge, cultural accommodation and preservation, and also facilitating client-centered care. Now, I would like to introduce my classmate, Rachel.
My name is Makinde Rachel. I'm going to talk about the roles of nurses in cultural competency. Nurses must recognize the existence of cultural differences, implement the issue with the client, create a safe place for clients to feel comfortable and express their cultural beliefs and needs. Nurses should check if there is cultural competence model or assessment tool that is used in the organization to guide their nursing practice. If there is no model or assessment tool, nurses should advocate for one, like CAPA barcode process of cultural competency in the delivery of healthcare services that focuses on the physical assessment of the client, ethic and cultural differences. Nurses can also use LAN and ethic as another means of model or assessment tools in implementing cultural competency with the client. A model for cultural competency is a process of cultural competency in delivery of healthcare service that view cultural competencies strive to achieve the ability and availability to work effectively within the cultural context of the patient, individual, family, and community. I'm going to talk about the five cultural competencies described by Kappa Barcode. One, cultural awareness. This process allows nurses to have a self-reflection on their own value and belief and can prevent them imposing their belief in nursing practice. The second one is cultural knowledge. The cultural knowledge allows nurses to have understanding about people's culture and as well as their own culture and only can be achieved by attending different cultural events, speak to people from different background and culture, and also reading a literature. The third one is have cultural skills. Having the cultural skill is important for nurses in nursing practice. Nurses should implement the skills in all aspects of client care in delivery of healthcare services. The fourth one is cultural encounter that allow nurses having interaction with the client from cultural diverse background. As a result of this encounter, nurses can have knowledge about different cultures and help them to deliver cultural competence care. The goal is to have a meaningful understanding about the certain culture and avoid any stereotype related to culture. The last one is cultural desire. This process involves nurses when they are interested in becoming culturally competency in their practice rather than forcing them. Recognizing the effect that the client's culture might have on their health and illness provides the holistic care in achieving the optimal outcome. Now I'm going to pass it on to Queen.
Hi, my name is Queen. I'll be speaking on cultural competent care of the Jewish. There are approximately 391,665 Jewish nationality in Canada. There are three different types of Jewish people. Orthodox Jewish. They believe that Sabbath day is a day for rest and no job is to be done. They adhere strictly to the Jewish tradition. They will not use electricity, operate cars, will not use cowbells on the Sabbath day. They observe strictly to the dietary rules. The conservative Jews. This set does not emphasize on Sabbath day. Some observe dietary laws and some don't. Reformed Jews. These are non-practicing Jews. Some beliefs and practices of the Jewish people are Sabbath day. They observe this day as a day of rest and devotion. Dietary rules. They believe that dairy and meat are kept separate during preparation, serving, eating, and no pork or certain seafood is allowed. Yom Kippur. This is a day for atonement. Fasting and praying is being done on this day. Rosh Hashanah. This is a new year. It signifies a new beginning and something sweet. They go to the temple or synagogue. Passover. This signifies meals served during the Passover night when Israelites left Egypt. They see death as one of life processes. Assessment. In the care of a Jewish, nurses need to have cultural knowledge of self and the Jewish, understanding of Jewish traditions, holidays, and fasting. Prayers and dietary needs are important in the care of the Jewish people. Nurses should ask open-ended questions to elicit information from clients. They should listen with respect and don't be judgmental. Communication. Nurses need to be aware of different communication styles and the influence of culture on communication. They should use a wide range of communication skills. And when in doubt, they should ask questions. They should not assume, because there are different types of Jewish people. They should validate information with the client. Advocacy. Nurses should advocate for the patients. They should advocate for supportive work environment, which may include availability of policies and procedures to support patient care, structural and human resources to support patient care, which may be a place to pray, separate dining, and a rabbi, which is a priest. Establishing mutual goals. Nurses need to be creative and committed to client-focused care. According to CNO Standard of Practice, it says that culture care preservation, culture care repatterning, and culture care accommodation are the different ways you can establish mutual goals with the patients. Culture care preservation involves making effort to integrate client preferences into plan of care. Culture care repatterning involves developing a new pattern of doing things while respecting clients' values and beliefs. Culture care accommodation involves exploring ways to honor client choice by minimizing risk and overcoming barriers. Making effort to integrate the patient's cultural preferences to the plan of care when the preference does not carry any risk of harm to the client or others. This may include Yom Kippur, providing clients time and a quiet place for prayers, and reserving patients' meals till when they are ready. Rosh Hashanah. This may involve facilitating a process where the clients could be taken to the synagogue or temple, providing the residents meals similar to their foods, e.g. apples and honey. Passover. Providing them with meals similar to the one used during the Passover, e.g. like red grape juice for wine and a leavened bread, that's bread made without yeast. Death. Providing clients dying with care that reflects their culture. In dying, nurses can provide and facilitate reciting of Bible verses to which is used in acceptance and reaffirmation of willingness to accept death. They should allow family members to stay on the bedside of the dying person. When the person is dead, eyes should be closed after death and candles lit. Family member is to be allowed to stay with the corpse, and windows are to be opened to allow the departure of the soul of the deceased. Thank you. I will now hand over to the next speaker.
Hello, my name is Muna, and I will be presenting the barriers and facilitators to cultural competence nursing care. There are many barriers to cultural competence nursing care, some being the nurse, lack of cultural awareness and experience and knowledge, the RN cultural imposition and ethnocentrism, stereotyping the patient's culture, lack of cultural diverse staff that reflects the community being served, and verbal and nonverbal communication issues such as language barrier, unfamiliar with the norms related to the facial expressions, body language, eye contact of other cultures. Patients' belief towards illness and treatment can also be something that can make the patient non-compliant. And when these situations are handled poorly, they can lead to cross-cultural issues, such as resulting in negative clinical consequences, patient being non-compliant, delay in obtaining consent and information from the client, ordering unnecessary tests, and increased healthcare costs, and also low patient quality of care. Facilitators to cultural competence nursing care are the nurse would need to develop a cultural humility and etiquettes towards the patient cultures and other, practice self-reflection and assessment. The RN must confront his or her own cultural and ethnocentrism and bias, and he or she would need to address communication barriers by providing specialized interpreter services. The nurse must be non-judgmental, accommodating, and incorporate the patient preferences into the plan care. Thank you.
Hello, my name is Nisa and today I'm going to present on cultural conflict and resolution. As we all know that conflict is disagreement in certain issues between two persons or two parties. As culture influences thinking and decision making, so culture is deeply embedded in conflict because culture shapes individual perception, attribution, judgment, and awareness of self and other. Culture is dynamic, and cultural beliefs of a given cultural group changes with time. Cultural beliefs depend on race, ethnic background, nationality, socioeconomic status, generation, religious and political beliefs, sexual orientation, and language, which makes cultural conflict resolution more complex. Prevention of cultural conflict by applying the principle of culturally competent care and active listening is recommended to avoid the stress associated with conflict resolution. Conflict resolution. Successful cultural conflict resolution in multicultural society consists of following three important aspects: desire and need to resolve the conflict, awareness of barriers associated with conflict resolution, choosing the suitable method of conflict resolution for a given situation. Methods of cultural conflict resolution includes creating a common ground. Identifying similarities between your culture and client culture, despite of focusing on differences, helps to create a common ground to resolve the conflict. Breakdown of power structure. It is done by respecting client as expert in their culture or in their life. Use of mediation. A third person can be used as a facilitator to analyze and suggest a solution to resolve the situation. For example, in the context of Jewish culture, we can always include rabbi with the client consent to help in cultural conflict resolution. This is the end of the PowerPoint, and thank you so much for listening.